Welcome back to Real Health. It's great to have you with us. Now, we've had a huge amount of positive feedback regarding our previous interview on the treatment of sexual dysfunction and the new innovative ways of using PRP therapy. So we've decided to invite Dr. Mark and Dr. Nicole Kanaris back into the studio to tell us more about the O shot as well as the ED shot. Welcome to both of you once again. It's great to have you here.
Hi.
Thanks, Michael.
Thanks.
Now, in terms of sexual dysfunction in both males and females, what has been the normal, traditional way of treating this dysfunction over the years?
Well, big disparity between men and women, because men you can actually see there's a problem, where the women, they're telling you. So it's always had a psychological root or a hormonal root to it. So those are the two ways it was treated in the past.
Right.
And never really been looked at as having physiological or anatomical problems in the area.
Okay.
So now it's really great that people are recognizing there may be other issues.
Yes.
Whether with men.
Well, with men, you know what we never spoke about is the psychological aspect. You know what, erectile dysfunction was always seen, okay, fine, I can't get an erection, but what was the causes?
Yeah.
We have few primary causes of erectile dysfunctions, and most of them, as the man will attest, is that, you know what, if it doesn't work once, your next sexual encounter is a very, very difficult minefield to negotiate.
Yeah. So it suddenly becomes a much bigger psychological issue than it was with the first time.
Absolutely, yeah.
Now, you mentioned, Nicole, a very interesting point that kind of starts this whole thing about women tell you about it or would need to tell you about it. But for so long, I think it's been this very taboo subject. You don't talk about sex with people, you know. You quietly go about your business, and if it doesn't work, you struggle through life, and it's your problem to bear, and you don't express it. And I think these days it's become a much easier topic to talk about. People are far more comfortable to talk about it.
Definitely, and South Africans are conservative. If you go to the States and you're sitting in a coffee shop, you often overhear women sitting and giggling and laughing, and they're talking about sex. In South Africa, it's very different.
Yeah.
Women keep to themselves, they don't talk about it. We like to say they suffer in silence.
Yes, yes.
So at least now there is a way forward.
Absolutely.
It's just educating people on what's available and how simple those solutions can actually be.
You know, it's like through programs like Real Health and you know, the radio interviews and stuff that we do, that we educate people that, you know, we have solutions for problems that you're too scared to vocalize.
Yes, yes. And I think, Mark, you mentioned as well, the first time a man has a problem, a sexual problem, it's a huge thing because there's also ego involved. So that psychology around that is
absolutely
huge.
You know what, it's very interesting, and I always joke with my male patients, but you know, when a guy starts having or suffering from a low libido, if he's in a relationship, he's always confronted with, you either don't find me attractive anymore, or you're finding sexual gratification somewhere else. Right. And you know, that's rarely the case. It's the guys don't want to go there because it's embarrassing, and I'd rather not be embarrassed.
Absolutely.
So it's something that they tend to avoid.
Yeah. Now, in terms of sexual dysfunction, there's the psychological, there's the hormonal, and then there's the physical or physiological aspect of it. What is the most prevalent within these three, or is it kind of spread across in terms of what people are dealing with?
Depends on age.
Okay.
And depends on sex.
Right.
Yeah.
But in women, early age could be physiological.
Okay.
And then later on, as they're reaching their 40s and their 50s, the estrogen levels start to drop.
Yes.
And then as you're premenopausal or menopausal, that plays a role
Okay.
in the aging of the organ, as well as your lubrication,
Right.
low libido. So then estrogen supplementation can also help.
Okay.
So with men, at the younger age, it's more psychological.
Right.
And as we move into our 40s and 50s, it becomes hormonal.
Okay.
And as we then age, you know what, comorbidity like diabetes and hypertension leads to physical problems.
Okay. Now let's go to the physical side. Last time we spoke about PRP therapy. In terms of ladies and sexual dysfunction, what is PRP actually doing? What aspect are we looking at? The physiological side of things, and what elements going on there are we working on?
So firstly, it's called the O shot.
All right.
And it's called the orgasm shot. That's how it was initially invented by a doctor in the States in 2011, so 8 years ago. And there's a group of doctors that belong to this organization that are able to perform these procedures.
Okay.
So it needs to be done correctly.
Yes, I imagine you want to registered professional doing it.
Absolutely.
Without a doubt, so that you have the reproducible results.
Right.
You can imagine having it done by someone who's not trained correctly. It gives a bad name to the actual procedure, where people think they're not getting the results,
Yes.
but it may have been done incorrectly.
Okay.
So it's treating different conditions depending on where you're injecting.
Okay.
So for patients that have no clitoral sensation, you'd inject into the clitoris.
Okay.
Patients who are not able to lubricate, they've got no libido, you're injecting into the vaginal area.
Okay.
And then we've also able to treat urinary incontinence, where
Okay.
we inject into the vagina to help strengthen the ligaments and the muscles,
Okay.
more collagen in the area,
Yes.
and it helps to stress urinary incontinence.
Okay,
It's very interesting when we treat patients with the O shot. The first noticeable difference is in urinary incontinence,
Okay.
especially stress incontinence.
And really fast.
And you know, it changes people's lives. It changes that
imagine.
lady that wants to go shopping but needs to know where the closest bathroom is the whole time. It's phenomenal. It really makes their lives more pleasant.
Okay, fantastic. And then moving on to men, I mean, obviously, as you mentioned, if it doesn't work once, psychologically it's a huge problem. What causes that failure to launch, if we can call it that, and how do you identify what is needed in terms of a PRP treatment? And also, it's called the ED shot, if I'm not mistaken?
In South Africa, in my practice, we call it the ED shot.
Okay.
There's the group of doctors that Nicole's referred to would call it the P-shot, but the P-shot is a registered trademark.
Okay.
So, you know, that's why we call it the ED shot.
Right.
So in my practice, we first go and look at hormone levels. A decrease in libido for men leads to less sexual thoughts and fantasies.
Okay.
And the interesting part is we don't need testosterone to have an erection. We
Okay.
need blood flow.
Right.
But if you don't have a sexual need, you're not going to stimulate blood flow to the area.
Okay.
And that's where the ED shot comes in. The ED shot is done into the penis. Guys, this is really not painful. We numb you perfectly beforehand.
Yeah.
And as we spoke in the previous episode, it's about stimulating new blood vessels to grow in there, regeneration of tissue and sensitivity of the nerves.
Okay. You also mentioned last time plaque buildup, or causing a change
A curvature.
in the shape. Yeah.
So it's called Peyronie's disease, and that can occur at any age. Usually it occurs after some form of trauma to the
Okay.
penis, where we have bands or plaques of connective tissue that then creates a curvature to either or any direction, actually.
Okay.
And by breaking this down and injecting platelet-rich plasma into the area, we regenerate the connective tissue, break it down, the collagen that's there, and form new collagen.
Okay.
So, you can treat it quite successfully with that.
Okay, wonderful. Now, going back to the psychological side of things, I imagine if you've undergone some sort of therapy, you've immediately got a mental boost as well, which kind of helps with your libido to some extent and will help you become more excited about sex again, especially for people who may for a number of years have struggled with this. What sort of results do you see there?
Well, I think for women, a lot of them correspond having sex or painful sex as a bad experience.
Right.
So now if you're taking away the pain component, they're able to enjoy themselves,
Okay.
their libido increases,
Yes.
and psychologically they're able to relax and enjoy it.
Absolutely.
So it definitely becomes a psychological thing.
Yes.
Increased blood flow to the area, they're able to get more excited. So it
Okay.
helps with the psychological aspects.
Fantastic. And for guys, Mark, I'm sure the same thing applies. It's got to be so exciting if you struggle for some time.
You know what? The biggest thing I think for the guys is that PRP treatment can enhance girth as well as length.
Okay.
So I have a lot of guys actually coming for that specific reason.
Okay.
But on the psychological part, when you know that there's proper blood flow, when you start getting spontaneous erections and morning erections again without any sexual stimulation, that's when we start seeing that the psychological part starts falling back into place and the guys are confident.
Okay, fantastic. Now, is this process or this treatment something that is ongoing, or is it something that is for a period of time and then you stop because you've done the work that needs to be done? I imagine age would have a factor in that though as well.
So age and health. But generally you do one treatment and you see your results 6 weeks to 3 months later, the full potential of it.
Yes.
Depending on what you're wanting to treat. If you're treating a medical condition like lichen planus, or depends on what you're treating. You may need recurrent treatments.
Right. Okay.
For the guys, the protocols that we have put in place, it's 1 treatment per month for at least 2 to 3 months, preferably up to 6.
Okay.
You know, when we're concerned about Peyronie's, it might be a little bit longer.
Yes.
And, you know, obviously enhancement of penile size. You know, but the more we do and the more often we do, the bigger the result.
Okay. Nicole, if people want to find out a bit more about this procedure and how to get in touch with you, where can they get hold of you?
So we're really active on Instagram. They can look up Dr Kanaris.
Okay.
Otherwise, we're located in Greenstone and our number's 011 524 0991.
Fantastic.
For my site, the T Clinic, just Google the T Clinic, and I'm Parkmore 011 784 1168.
Well, I think you guys have given a lot of people a lot of hope in terms of finding that flair again and also being able to just enjoy sex as we are meant to do as humans. I think it's wonderful.
Absolutely.
Thank you so much for telling us about it.
Thanks.
Thank you.